I found when I was studying as a student one of the most insightful times of my life, where I really did reflect on who I was as a person, and I thought I was absolutely fabulous before I started, and then realised I wasn't quite as fabulous as I thought I was. But by building and developing those strengths and being around like-minded people really does help to continue and grow and want to be the best that I can be when I'm supporting children and their families around them.
I don't think I would change my journey, and I think it is a journey, and I hate saying things like, oh, it's a journey and you're going to go on a journey, but I wouldn't change my journey for anything. I think that I learned a lot about myself over the course of the degree, which has then helped me in my practice.
I'm going to start this evening's webinar by just talking about very, very briefly about what do social workers do. I mean, that's $1 million question, and there's lots of myths about social workers that exist in this country. So one of the most enduring myths is that social workers only ever work in child protection, and you'll see this myth kind of when they showed social workers on popular TV programs. And one of the myths is that social workers can go into a house and remove a child if there are concerns about them. They don't have the power to do that. The other narrative is that we as in children and family social workers, either fail to see child abuse when it's obvious, or we take children into care unnecessarily. So there have been some public inquiries into social work over the years. The other myth is that we interfere in private family life, but the other myth is that we help people. We do help people, but again, we might think about what helping people means. Preventing crime, we do our best, but that's not really our role, and we can't really save the world. That's the kind of myths, but what is it? Really, it's about trying to empower the people we work with, and as far as possible, giving people choices, supporting and protecting them. A key task is really addressing social injustice. So social workers work with people who are often othered in society. Our role is to contribute. We don't often as part of decision-making panels, but contribute to well-informed decisions that make sure children and adults are safe. So there is significant social work activity working with adults. So we may assess adults and children or people that are in need. We are required to be curious. We don't take anything at face value and reflect on our thoughts and opinions and our decision making. And we try and see people holistically. So it's not quite a medical model. We see people as very much part of a community or not part of a community, or subject to structural discrimination. So it's about the environment, so how people operate, but so both internal and external worlds. And that's what makes social work quite a unique profession in how we see people very holistically. So I've got here the global definition of social work, and this is the International Federation of Social Work organisation, and they've got this global definition which is increasingly being taken up by social workers who are in more and more countries. But I've underlined the important part. So it's a practice-based profession. We work with people. But social work is an academic discipline. You will learn about various theories, knowledge and skills whilst on the course. But the idea is that we promote social change and development, that we promote social cohesion, and we try and empower people. So not do to people, but work with people. And at the heart of social work are principles of social justice, human rights, collective responsibility, and respect for diversity. So a big part of social work training is reflecting on our own biases, our own prejudices. If you complete the programme with us or any other provider, it does mean you're eligible to register as a social worker with Social Work England. So social work is a protected title, so you cannot call yourself a social worker unless you've been on an approved programme and are registered with Social Work England. So there's different regulatory bodies in the different parts of the UK. Social workers, yes, they work for county councils or local authorities, but they also work in the voluntary third sector, charities and private settings. So we would call Suffolk County Council is a statutory setting. And usually, on the whole, social workers work within statutory guidelines. So there are various laws and policies that direct social workers to what they can and can't do. And on the course, we would teach about law as well. And social workers work with people pre-birth up until the time of their death. So from, pre-birth up until the time of death. So children and families, adoption, fostering, family support, safeguarding both children and adults. We work with people with disabilities, people with mental ill health, forensic mental health, elderly, drug and alcohol users. So a whole range of people we would work with. And as I said before, our work is underpinned by a set of values and a code of ethics.
The course is 3 years. The first year, you do 4 modules, so you would be in university 1 to 2 days a week. In the second and third years, that's when you do your placements as well. So you would be doing placements lasting for 70 days in the second year and then 100 days in the third year. Those placements may be within the local authority, working with children and family, or they may be with adults in a range of areas, or they may be in the private and voluntary sector as well, for example, at the ICNE project. So we have students who have experience of different placements.
I think kind of what inspired me to become a social worker, I have worked for the local authority now for nearly 11 years, which seems a bit crazy. But I started in adult social services as a reailment support worker. So I was a home carer, going in, helping people who've just come out of hospital, helping the elderly. And through that, I met lots of social workers who inspired me and kind of put faith in me, that then gave me more opportunity to go and start doing the assessments instead of being the carer in. And then I was sat with Amanda Takvarasha, who was my manager at the time, who's now the principal social worker for adults. And I was kind of at a crossroads in my life where I didn't really know the next place. And me and Amanda sat down and we worked a 5-year plan together of what I would do, what I would apply and where I would go. Unfortunately, Amanda wanted me back in adults and I'm now in fostering and adoption. But yeah, I think you meet people and as students, you will meet people on your placements that are so inspiring, and that kind of social work becomes so much more than just the job that you do.
I'm only about 9 months post-qualified, so not been in quite as long as Adam. But for me, it was a very personal journey, becoming a social worker. I thought many years ago, just before leaving high school, I thought I might want to do it, then got sidetracked by life. And then a lot of personal experiences led me to becoming a community worker with a charity, a local church actually. And during lockdown, I made the decision to go for it. I phoned up the local college and I said, I want to be a social worker, tell me how to do it. And that was right back from just GCSEs and nothing else in between apart from life experience. So yeah, I think it was personal circumstance for me.
Yeah, so for me, I think social work found me really. I needed a job and somebody came, a friend had said, you need a job, don't you? There's a job here at social care in Woodbridge, as it was then. And I became a business support administrator initially and just fell in love with social work, really. Just understood it more. I could see sort of, how it worked for children and adults. I was supporting social workers. But the best thing was like taking telephone calls from adults and service users and carers for children, and just having those conversations over the telephone. And it just really inspired me. I just felt like I'd really found my place, and it really inspired me to then go on and do some more training and then do my degree. So yeah, I've been qualified for a long time and I still love it. And yeah, it's a great profession.
I worked for the NHS for many years, and I also studied paramedic science at University of Suffolk, and I left during COVID, and I was every intention to come back, but I didn't for some reason. But working in the NHS, I saw firsthand sort of how many patients needed more than just medical care, but they needed support, advocacy and a long-term solution. So I found myself thinking about what happened to them after they left our care, especially those that dealt with homelessness, domestic abuse or mental health struggles. So that's what really drew me to social work. And it was more the chance to be a part of the ongoing support system and to help people rebuild their lives and not just treat the immediate crisis. So that was kind of what mainly got me into social work.
And Kelly, what made you want to come and join the course and be a social worker?
So it's pretty similar to Ellie as well. I started when I was 17 at Woodlands Psychiatric Hospital in the mental health act team, and I worked there for several years. I was also a carer for my sister who has quite severe autism, sensory processing disorder and other disabilities. So I've seen it from a personal point of view as well, just how invaluable these services are and how much is out there. And there's a lot of things looking back that could have made such a difference. And then that sort of made me want to go on and be able to kind of help other families and maybe fill in that gap that we didn't have as well.
Your placement somewhere completely different, in a school.
Yeah, in a school, which isn't something that I thought of, A, for social work or B, as a placement, but I loved my placement in a school. I loved that I saw the children like every day. So it was quite nice to be able to build those relationships, and they'd come and find me at break and lunch. I often had a queue before I was even in the office in the morning. But then to see them grow, so a student that would be in my office all day, by the time I'd left, was in lessons all day and just sort of had a brief check-in at break times. And to be able to follow that progression, working with teachers, the pastoral team, and then still getting to go out with sort of to do welfare checks and home visits as well. Communicating with the family, sort of being that bridge between home life and school life, and sort of having that communication as well. And then I had a really great practice educator who I then got some opportunities to shadow in the local authority within her team as well. So I sort of got a bit of the best of both worlds.
There's also lots of support services within the university. We have, for example, quite a few students who are neurodiverse. And we adapt, and we want everybody to be included and participate in education.
I'm in the kinship team, and I think kind of the most rewarding thing for me was I was actually in the kinship team as my children's placement. And so when I came back to the team, it meant that I actually got some of my old cases back, and to kind of see the growth in them, and I took quite a few of those through up until they were private fostering. So unfortunately, they only stayed with us until they're 16. But to see them when I saw them when they were 13, and then I come back and they're 15, nearly 16, and helping them to then go into their next stage, I think that was the most rewarding for me, to see how far they'd come and how much they'd changed and how the support had really helped them.
Suffolk County Council are really good at offering development opportunities. I'm already doing the academic module towards my master's in the ASYE, and I've got big plans. There's lots of different modules to consider. But at this stage, I feel like I've already been able to buddy a new student on the Think Ahead programme this year, and managing that as a newly qualified, I feel like taking on that role in the future, maybe practice educator, maybe moving up to senior prac at some point. But definitely I want progression, but I want to keep in touch with the people on the ground, the people we work with.
Sort of going forward, there's positives. There'll be like the new technology, AI, things like that is going to really support our sort of recording and the time that we spend in front of a computer, and social workers spend in front of computers. And it will hopefully then allow us to be out with having those conversations with individuals and, hearing what they want to achieve, hearing their voice. And I think in adult social care, there's lots of transformation programs, and it's people at the heart of care. So that's really exciting for us that we're moving forward at pace. We're making sure that we've got really sound information, advice and guidance for people. There's transformations around our front door offer and supporting people to sort of have the right support to support themselves and promote that level of independence. So there's really, that's a really key point, sort of most people want to be independent. They don't necessarily want sort of to be reliant on services. Even, we see people at their most vulnerable and we want to then empower them to regain that level of independence. So I think that's a key theme that runs through the transformation, and that's really supporting some changes. Going forward, we've got far better mechanisms for monitoring our sort of service, how that works, how well we're performing, making sure that people aren't sort of lost on waiting lists. So we've got far better sort of digital tools to do that, but we'll also have far better digital tools to support practitioners on the front line to do those assessments and spend more time actually with the individuals and their families, actually having those really rich conversations and gathering that information. So I think we're sort of moving forward in a really positive direction.
So your top 3 tips, perhaps, what would you say?
So for me, number 1 would be to make sure you access all the support and all the additional sort of support that is out there. Like take all the tutorials, go to the library, take up every opportunity you can. Because before I studied paramedic science, I'd never done that. And being in this degree and accessing the support, I just feel like I'm really making the most of my university experience. And I feel like it's been so helpful.
For placement, I would say trust the process, because my first day of placement, I walked in thinking, what on earth am I doing? I'm never going to do the portfolio. I'm not going to meet all the PCF standards. I felt like I should have just walked in and been like, I'm a student social worker, I know what I'm doing. But that's not the case. But just, trust the process, because it does work out in the end.
Yeah, that's a good one, actually. And going on from that as well is taking full advantage of being a student. So with your placements is like, if you don't know something, ask all those questions, talk to the service participants, because you're going to get the most amount of information of the people that actually use the service. Make the most of being a student.
Good. Any final tip, Kerry?
Yeah, don't leave your assignments till the week before. The other thing I learnt was like the PowerPoints in the lectures. Like in first year, I was a bit like, oh, okay, that lecture's done. But then I learned actually if I then go back over it, because it keeps coming up, even in second year, we're talking about things we learnt in first year. So when there's reading lists and the lectures do get put up in the PowerPoints, they're there for a reason. That definitely go back over them.
I'm unapologetically me. And I think that you identify the strengths inside you, but at the same time, when you do that, you identify the things that aren't necessarily a weakness, but they're things that you have to be conscious about. I always feel very fortunate. I've got a great team. I've got a great manager. I've got a manager that's incredibly supportive and understanding. And I think you are your best tool. So always remember that. And some days are tougher than the others, but it's okay.
If you have any questions whatsoever, please contact any member of the social work team. We're quite easy to find on the website, but there's my email address, and I put Maria's, Quabbana's put his in the chat. As I said, don't be shy, pop in. We're a very, very friendly university. There's lots going on.